Aloha everybody, this is David from the Alpona Wellness, and I'm just going to be talking about just some little tips on how to stay mobile while you're in the airplane. One of the biggest things, that I get, complaints that I get from a lot of clients and patients is, you know, gosh, flying at least minimum 5 hours to even, 14 hours, depending on where they're going on in the world. They always talk about how long or how the effects of long durations of sitting, can have on their back, on their legs, right? And the idea is not to overwhelm and make our bag as heavy as can be. So what I have here are the major tools that I like to travel with and that I encourage a lot of my clients and patients to carry with. So we got our Alpha Ball here from Tune Up Fitness. Um, Depending on the type of thing that's going on with our client or patient, or ourselves, we'll use these little therapy balls too, right? Again, we want to make sure that we're able to minimize the weight that happens in our carry-on. But what's also nice is we can use percussive instruments such as the Theragun Mini, our new Theragun Mini from Therabody. Even though we're going to be using it on a plane, it's not loud at all. It's super, super quiet. I don't know if you can probably barely hear it, but I'm just going to walk through some different techniques on how we can utilize these tools to mobilize. Okay. A lot of people have some difficulty or some tightness that goes on in their SI joint and their lower back. So what I like to do to give a little bit of attention right into this area where kind of in between the hip and the trunk, right? And we can kind of explore a little bit around here. And the reason why I'm in this kind of sitting position is so that I can kind of take up the tension of this line that's going on kind of between our IT band and our lateral quad. Freeing up this area opens up kind of a lot in regards to what's happening at our lower back when we're sitting for long periods of time, right? Now, things to take into consideration are the size of the seats that are provided for you, and probably the adjacent passengers that are next to you. But those are small types of things that you can do using Theragun, right? At least in the lower trunk, right? Without having to kind of give an elbow to your next door neighbor. The other stuff that we can do, though, you can address like things that are happening at your neck, right? And the things that happen when you're sitting for long periods of time, like you can get headaches. You're trying to look at the screen, for long periods of time, right? And what happens is all these areas get super, super tight. Maybe even like from trying to find a comfortable position when you're trying to fall asleep. These areas can get super, super tight. So these are perfect areas to kind of address using this Theragun Mini, right? And I like to make sure that I hold it on the same side that I'm doing it on, rather than kind of crossing over. Most of the time, that'll get a little uncomfortable on the shoulder if you're going across. All right. Okay. And so next, we're going to use our Alpha Ball here. So what we can do is take a look at what's happening in the hamstring area. As we all know, sitting for a long period of time, especially in this bent position, can create a lot of tension, whether it be in our lower back or even in our hamstring area, right? I like to start here in the hamstring, mainly because I feel like it kind of frees up a lot of things that goes on, as we're sitting for long periods of time, where things kind of feel real stuck, especially in circulation of our legs. I used to have people just kind of address the lower back, and I guess it would depend on what they're complaining of the most, or what we're complaining of the most. Like if it's real tight in the lower back, we can start there. But again, starting at the hamstrings, I feel kind of open up both channels, going on the way up as well as on the way down, right? So starting on the ball, on the the bones that we sit on, in other words, what we can do is kind of explore in this area with the mobility ball. And we can actually explore quite a lot in there. We can explore muscles that attach into the groin area, which can get really, really sensitive and tight when we're sitting for long periods, as well as the hamstring itself, the tendon that attaches right into the sit bones that we have here. Okay, be sure that you use or you perform these mobility exercises on both sides too. Okay. Another thing that you can do, nice quick little tack and stretch technique, just sitting on this mobility ball and just kind of straightening out the legs as much as you can, because obviously we don't have that much space, in the airplane. But if you can get a little bit of movement while you're putting compression in there, you can open up a lot of things that's going on in there and prevent a lot of the pain that goes on with traveling, right? The other thing that I would do is you can also explore the glute as well. You can use these in a similar manner, right? Putting this underneath the leg once again and performing it in the same way that how we use with the alpha. Personally, I like to use the alpha because I can explore a little bit more in the glute, which is typically larger muscles, right? Okay. Now the other stuff that a lot of my patients and clients ask about are like, what about seated positions, right? And so I just want to briefly go over what that means and what it can look like. I mean, I know we're looking at it from the front, but I'm also going to show what it looks like from the side, right? So this would be probably one of the blankets that you would get on the airplane, or even a pillow, right? And most of the time, people want to put something on the small of their back or the curvature on their back, right? Right over the lumbar spine. What I actually find works really well is going in that area just between the mid back and the low back, right? It's that thoracolumbar junction is what we call it. And so when we put it there, right, I'm going to show you from the side, okay? What we can actually do is, instead of placing your pelvis at too much of a curve and creating a lot of pressure in the lower back, what we do is we actually kind of create a little bit more of a neutral position in our lower back, right? And when we have the seat belt, we can put it right across our pelvis, so that way we keep our pelvis stable in this area, as well as kind of giving us room to breathe and give our spine a nice neutral position, so that way we're not putting all the pressure within the joints, right? From the side, okay. So again, we're going to be putting this right between our mid and low back, and as you can see, like, our spine is in a much more neutral position, rather than bringing it down lower, right? And then we have this emphasized lumbar lordosis, right? And that's what we want to try to avoid, especially if we're sitting for long periods of time on the airplane. Thanks again, and I'll see you folks next time. Aloha.